What's up, guys? I know I haven't made a video in a while. It's been a pretty busy last few months for me. It is now mid-December 2017. My last video was back in September, maybe early September. I had just taken my board exam back then in my last video. Um, for physician assistant certification. It turned out that I did not pass, and I was pretty disappointed in myself, really upset. Did not know what was going to happen next, if I had to wait a year, and I just didn't feel like making any videos. I was just upset with myself, and I shouldn't have any excuse, but I underestimated that exam going into it, and I also didn't give myself enough time to study for it. I took it 2 weeks after finishing PA school, and with my program, we end PA school at after our last rotation. So usually we take rotations. We have an exam at the end of our rotations, and unless it's an elective, you don't have to take an exam. So in my case, my last rotation was an elective, and I didn't have to take an exam for that, so I didn't really have anything to study for. Usually, as you study for during that rotation, you get you freshen up on all the material, and it kind of helps you with studying for other things. But I kind of took that last month off because I was a little bit burnt out, and um, so I didn't really study as much as I should, and I thought maybe I could study 2 weeks and take the board exam, not really knowing what kind of exam it will be, but I thought I'd be good. But it is a pretty big exam, 300 questions. It took me 5 hours to do. They also give you breaks, a 45-minute break that you can pull and utilize while you take the exam, but I didn't take any breaks. I kind of just powered through the exam, and it took me, again, 5 hours. Pretty exhausting, and you know, um, I found myself with a question that I might not be sure of, stopping and just taking too much time on that question until I was sure that I wanted to select the particular answer. And you shouldn't do that. You should pace yourself. You should not spend too much time on a question. If you're not sure, um, take your best guess, because you're getting graded on the number of questions that you get right. And each question has different weight. The more difficult questions will have more weight, and that's how you're graded on this exam. You can never really tell what your grade's going to be because they grade a particular way. So again, I was upset with myself. I didn't know what I was going to do. I immediately that day I found out that I didn't pass, looked into, and I signed up for the next exam. You have to wait 90 days before you could take the exam again. So it's not like 6 months, it's not a year. So that was good for me. It's plenty of time for me to study, even though I wanted to take it right away. I wanted to get certified right away. But I signed up and paid another $500 because it's 500. I think it's 600. I don't remember. It's 5 or 600, and it gets expensive. And so that's what I did, and I had 90 days to study more, study hard. I wasn't really sure. Um, what I did was I set goals each week as to certain sections that I would study and get through. And this is my Bible. This is what your Bible should be. Throughout PA school, didactic clinical year, PANCE Prep Pros. This is what I use for the most part. I also have an app in my phone. Sorry, I used. Um, can't really see, but Rosh Review is an app with over 2,000 questions that are pretty good. It's pretty good because um, the questions will break down everything you need to know about that particular subject. It'll have a vignette of somebody presenting with certain symptoms. What is it? And then it'll break down, after you answer it, it'll break down everything you need to know about that particular topic, as well as the questions, the answers that are the wrong answers. It'll talk to you, it'll tell you a little bit about that as well, about those other answers and why they weren't the right choice. So I felt that was pretty helpful. I also have another one called, it's a simple one. It's called PANCE, PANCE slash PANRE, PANCE Painry, and that this app has 2 practice board exams on it. So two tests, 300 questions, and there's also a timer on it, and it's very helpful as to getting yourself ready for the real board exam. So I took the first practice exam, saw how I did on that. I took that early on in the 90 days, and then I took the second one a week before my second time taking the board exam. But again, PANCE Pearls, definitely gonna need this, and I tried to memorize this whole book. Okay, you can see how thick it is, because what I found out on the board exam is that there's a bunch of these, what I call small detail questions, the questions that will ask about something that you might overlook while you're studying. So in this you'll see something like tuberculosis, right? And it'll have all this write-up about it, what it looks like, how to treat it, how to diagnose it, risk factors. But there's a lot of little things, small little details that you might overlook, like towards the end of, let's say, a small little risk factor that you might overlook. That'll be on the board exam. It'll ask you something about the small details that you might overlook, because you're coming in. I came into the exam having just the big picture things in my mind. The things that how, what is, what's hypertension, how do you treat it, what is it, what are the risk factors for hypertension, and things like that, and the big picture things. But I didn't really look into the small detailed things, because it's 300 questions. They can't ask you 300 big picture questions. So that's just one little tidbit, that for those of you getting ready to take it, study those small little detailed questions. I know that always is going to be on the exam somewhere, even though there's a lot of pharmacology on there. It's going to ask you side effects. It'll ask you contraindications. Why does this person have this particular rash or particular symptom? What medication might be causing this? And it'll give you a list of medications. Also, I know for sure will be on there is your nerve endings. Let's say you remember L3, L4, L5, C1, C2, C3, C4. What muscles do these innervate? Do they affect? If there's some kind of injury to L3, L4, where are you going to find a weakness? That's what I found on both exams. So I took the exam a second time, okay, and I felt the same way I felt the first time. It was hard again. All right, this exam, I thought maybe, okay, I memorized PANCE Pearls, I should be good. I took it a second time, and it was hard. I had a lot of that scratch paper that I had a lot of marked down that I wasn't sure. I went back and double checked after I took the exam, and I saw I got a lot wrong after going back home and looking in the book to see remembering questions and then looking it up. I was like, dang, I got that wrong. And there's like 12 of them right off the bat that I was like, I got them all wrong. I think they asked, one was like a risk factor for OCD. What might a person with OCD have a risk, and it was hereditary. It was hereditary, and I overlooked something like that. So I had a rough week after taking it the second time. I was so nervous. I was thinking, all right, I'm gonna have to study and take it again. But I had the email come in, and it turned out I passed. All right, I was a little bit scared to open this email, but I passed, and I'm a certified PA, and I don't have to take this exam for another 10 years, but that's what happens. I feel like I can make a video now on every possible scenario that you might go through to get into PA school, in PA school, and after PA school. Okay, I feel like I've been through it all. So just want to let you guys know what I've been up to and what's been going on. But it came to a good ending in the end. So again, subscribe if you haven't, and again, I'll be trying to get more videos up for you. Again, thanks for watching.